Canadian cases of HIV/AIDS appear to be on the rise, and that comes at a time when the number of global cases is falling. A new study that was published in the Lancet HIV Medical Journal says global infections were down more than 20% between 2010 and 2021. That's attributed mostly to dramatic improvements across sub-Saharan African countries. But the latest numbers from Health Canada show a 35% increase in diagnoses in this country last year compared to 2022. While treatments are saving lives, the rate of infection isn't only climbing in Canada. Researchers say other wealthy countries are seeing it as well, and they say more focus is needed on things like education and prevention. We're going to get some education now from Dr. Isaac Bogoch, an infectious disease specialist at Toronto General Hospital. We always think of you as being this sort of COVID expert, but you're actually an HIV expert, from what I understand. Can you give us a sense of your take on these numbers and this increase in Canada? Why is this happening?
So I think a couple of important points to identify. One is that HIV is still an incredibly important issue, not just globally, but in Canada. And although we have the technology and tools today to prevent it and to treat it, we still have a long way to go to ensure that everybody who is on a preventive therapy or on treatment has access to that. So I think that's the biggest takeaway point. But when we look at those numbers, I think we have to, nuance and details are important. So is there a rise in HIV in Canada? Well, we see those numbers show a pretty significant rise compared to last year. It would be important to break those numbers down to see exactly what's happening. So I think indeed there are truly issues in Canada. There are places where they are seeing more cases of HIV, and obviously that warrants a ton of care and attention. I think we also have to acknowledge some of those numbers may still be driven by testing challenges during the pandemic, and we might see some artifact related to that. And the third issue that we have to consider is some of those numbers may be related to known diagnoses in people who are newcomers to Canada. So while obviously those individuals will still need care, compassion, we have to be careful to ensure that those aren't counted as brand new diagnoses here in Canada when they are known diagnoses in those who have immigrated or moved to Canada.
Okay, so what can we take away from these numbers then when it comes to the question of how well are we doing here in Canada when it comes to prevention? I
think we're doing relatively well. But there's clearly room for improvement. So in 2024 in Canada and fortunately in many other parts of the world, we have very, very high quality methods to prevent HIV. We have something called PrEP, which is known as pre-exposure prophylaxis, where people who are at risk of acquiring HIV, who are HIV negative, go on a medication, and it effectively reduces their risk of acquiring this infection. It's remarkable. It's rolled out significantly in Canada. Yes, there's still room to improve in terms of lowering barriers to accessing this, but it's done a remarkable job, and it's transforming the pandemic. The second thing is ensuring people who are living with HIV have timely access to diagnostics and treatment. And again, people who are living with HIV who are on treatment will live a long, healthy, happy, normal life, and they will not transmit HIV to other people as long as they are on medications and have what we call a suppressed viral load. If they are, quote unquote, undetectable, they are not able to transmit the virus to other people. And that's another remarkable way to reduce the risk of HIV by ensuring everyone who is living with the virus has access to diagnostics and treatment.
Yeah, and you know, when you talk about access, what are some of the barriers that are still in place here? Why can't some people get proper access to some of those preventative measures and to the treatment that they may need? Yeah,
I think there's the unfortunate scenario that's all too common where people either have, they might not speak English or French as a first language. They might live in impoverished conditions. They might be without a home. They might have mental health disorders. There might be significant stigma and fear related to the stigma, preventing them from going in to get a test or access to care. So there's a number of issues that are still posing significant barriers, which are manageable. We can do this. If we have the political will, if we have the finances, we certainly have the tools to ensure that people have timely access to prevention and care.
Okay, and so we're looking at actual research here. I'm going to take you down this sort of anecdote. Just last week, I was talking to my family doctor who said, you know what, the number of STIs that she has seen and she has diagnosed over the last little while has gone up a lot. Have you seen that?
I have in my clinic, and I think when we got to be careful about the plural of anecdote is anecdotes, not data, but I think it would not come to any surprise if when we do see the data, if we do see a rise in bacterial STIs. Chlamydia, syphilis, gonorrhea would be the big three. Of course, there's others as well. And again, I think a lot of this goes back to good education, safe sex counseling, use of condoms, and of course, lowering barriers to care and treatment for people that might be impacted by these.
Good education here today. Always a really good reminder. We think these things are often gone. They are not. That is clear. Thank you so much for your thoughts on this today, Dr. Bogash.
My pleasure.